Keep going. Okay. All right. So, sorry about that. Me and Virginia still learning how to do this. If you don't like how we do it, we'll give you money back. So, but he designed this because of small children. The cat tourniquet is actually my preferred tourniquet. I would prefer to use this. It's wide, which cuts down on the risk of injury, and it's easier to use. But if it's a small child, it may not get tight enough to stop the blood flow. So the rat tourniquet is very simple. It makes a loop, and we're going to pretend it's this arm. So all you're going to do is wrap it, and you're going to wrap it a few times. You're going to try to wrap it where it covers about 2 inches, and then in this metal piece right here, you're going to tuck it. Now, if I do a capillary refill check, well, I don't have it quite, but it's over 3 seconds. I don't have it quite tight enough. But that's how you would apply a tourniquet, a rat tourniquet. And like I say, it doesn't work as well, I think, as the cat, but if you've got small children, it does a decent job. And I'm gonna do something you should never do. I'm gonna take my own tourniquet off after putting it on. If you take your tourniquet off after you put it on, you develop what's called, or you may develop what's called a training scar. And what that is something that you do in training that you wouldn't do in real life. So you put the tourniquet on, then you turn around and take it right back off. So that is the use of a rat tourniquet. Now a cat tourniquet, or a combat application tourniquet, is very similar. So what it has, you have this section here that forms a loop through this buckle, and you've got a windlass. And this windlass cranks, and if you look right here, it's got a plastic piece. So once you crank it down, you tuck the windlass under one of these plastic ears, which keeps it from coming out loose. Take your tab and put your tab over the top of it, and that keeps the windlass from coming apart. So it's very similar. What you do, you go high and tight, so we go all the way up into the axillary area. We're in the armpit. What we're going to do is we're going to pull it tight and come over. Okay, we're going to take our windlass and we're going to crank. And it doesn't really, and you're going to crank it till you crank it no further. And when you do that, you're going to tuck it under that ear and bring your tab across. Okay? It's real simple. If it doesn't hurt, it's not tight enough. Again, we would check for a pulse or capillary refill. And I don't have it tight enough because I've got capillary refill. The idea behind this is it cuts off the blood flow through the brachial artery. Now, why do we go up here? Well, there's a couple of reasons. First reason is you may have multiple wounds. Oh, before we do that, the only difference if you're using it on the leg is just slip it out of the buckle, come around your leg, then go back into the buckle, and then it's just the same. You're just pulling it tight and using your windlass. Works just the same as on, but instead of using the loop, you'll actually take it out of the buckle. How effective are tourniquets? Exceedingly. The number one preventable cause of death in combat, of course I've not been in combat, but what I'm told is hemorrhage, blood loss. One of the guys that taught one of my classes worked as a private military contractor in Iraq, and when they would go out, they would already have 4 tourniquets. They would have a tourniquet on each arm and each leg. Now they weren't cranked all the way down, but they were in a position so if they were hit, they didn't have to get it out of their kit. They just cranked it down. Actually, one company, and I don't remember who it was, I believe it was Blackhawk, made uniforms that the tourniquets were sewn into the uniforms. So you had one in each arm and one in each side of the groin. So they're very, very effective. The problem we got, the Roman legions used tourniquets. We used tourniquets in the Civil War. One of the problems we had was they were used inappropriately, like in the Second World War, Korea, and Vietnam. It was an instrument of last resort rather than a first resort. This is one of the first things you should do. And they would wait till it was almost too late. Now, you can leave a tourniquet on for 6 hours and you won't damage the limb at all. Now, and we're gonna talk about this in the respect that hopefully society is not completely collapsed and we can get you to a trauma unit where you can be fixed. It's gonna be beyond the scope of these videos to go over if we gotta do it in the backyard with a cold wall lamp, you know, and anybody in their right mind would not want to do that anyway. But you want to get as tight as possible. If blood flow, if you don't have it tight, blood can still go into the limb, but not have enough pressure to come back, and you can have what's called compartment syndrome. And that's a problem. Now, the reason we go into the armpit and into the groin, two main reasons. First off, in your lower leg and your forearm, you have two bones. You've got the fibula and tibula down here, you've got the radial and ulnus here. And if you crank on a tourniquet down here, you're actually compressing those bones. And that can cause trauma in itself. But in your upper arm, you have the humerus, and your upper thigh, you have the femur. So you only have one bone. So you compress the brachial artery or the femoral artery. And you're not causing damage as long as you've got it approximately 2 inches wide. You won't cause more trauma by applying the tourniquet. The second reason, which is equally as important, is you may have multiple wounds. You may have a wound in your lower leg and your upper leg, but this tourniquet will take care of everything from the groin down. Now, sometimes you actually have to use two tourniquets side by side to get the blood flow to stop. But it would take care of all your wounds in that limb. The third is, one of God's designs to our body is, when we have trauma like that, sometimes the veins and arteries actually kind of suck up into the limb to help stop blood loss. Well, if you put it down here for the wound, but it's sucked up to here, you're not compressing the artery. There is a scene in Black Hawk Down, and I don't know if it's based on real life or it's Hollywood, but one of the soldiers, and I'm assuming it has to be the femoral vein, it can't be the artery, he wouldn't have lasted that long, but they weren't using a tourniquet. The medic was trying to clamp the vein to stop the bleeding, and it sucked up into his pelvic cavity, and there's no way for him to get it, and the boy died. Now again, I don't know if that's Hollywood or if that actually took place. Regardless, the lesson is there. Use the tourniquets, okay? So, how important are tourniquets? I got one in my pocket, I got one in my IFAC, I keep one in my rifle. That's how important they are. Actually, for a little bit, I'd almost walk around with four of them just for funsies, but that's not really practical. So, the next way we're going to worry about our hemorrhage is, again, the areas that the shoulder girdle and the pelvic girdle where we can't use tourniquets. So what we're going to do, we're going to pack them. Now, and I'm just going to use an old bandana as an example. I meant to bring it, I think I took it home. There is what's called, you can use plain gauze. Doesn't have to be anything fancy. You can use Curlex, 4x4s, doesn't matter. You can use an old nasty bandana if that's all you got. Let's assume we've got his tourniquets on and we have done the blood sweep. So what we've done, we've wiped our hands off, or we changed and put gloves on, and we're going to sweep down each arm and each leg. So we're going to do this arm and make sure that we don't have any fresh blood. We're going to do this arm, make sure no fresh blood, do the legs. So we've got that taken care of. But he has a wound here, it's broken his clavicle or his collarbone, and it's above the lungs. So what we can do is basically take your thumb and hold pressure. Get your gauze, and then we're going to pack. And ideally, we would want this to be sterile. But in all honesty, that's not our first concern. Our first concern is stopping the bleeding. If I do this as a sterile procedure, and I take too long and it bleeds out, I'm not accomplished anything. So we're going to take it, and we're just going to cramp it. And this is, As the old man said, this is an owie, and he's gonna holler. But we've got the crown that pack it in there, and then we're gonna hold it. Now, all things being equal, he's our only casualty. Everything else is taken care of. I'm gonna hold this for a minimum of 3 minutes. Even if he's on blood thinners, Coumadin, warfarin, warfarin is Coumadin, Xarelto, Eliquis, it doesn't matter. You hold blood pressure for approximately 3 minutes, it'll stop most of your bleeds. Now they do make gauze that has a hemostatic agent in it. It's called combat gauze or quick fly. And that works much better, especially if you have an elderly population like in church. And they may be on blood thinners. What you would do is, now it doesn't come in a big pack, it's a smaller. So take your combat gauze, cram it in first, then take your curl extra 4x4s or your other packing and pack on top of it, if that makes sense. So we're gonna cram it in and we're shoving and holding with our thumbs, and we keep cramming. Then we're gonna put 4x4s over the top and tape to hold it. Okay. So we've taken care of bleeding, hemorrhage from our appendages. The pelvic girdle is the exact same way. Put your thumb in it, cram it, hold pressure. We've discussed the abdomen. Now the chest. Now on the chest, we're not so much worried about bleeding. We're worried about what's called pneumothorax. And what pneumothorax is, stuff out here. If you take a high velocity round to the chest, you can have what is commonly referred to as a second chest wound. There is a gap, and I don't know if y'all be able to see this. Virginia uses this as a nerve target, so it's not the best in the world. But between, just inside your rib cage, between your rib cage and your lung, there's what's called the pleural space. And it's a little bitty just gap. But if you punch a hole through here, you can let air get into that pleural space. And what it does, it does not allow the lung to expand. Now, we've actually jumped a little bit ahead, but this goes under the trauma, not under CPR. So what we want to do is, if this lung collapses, and it comes, that is a pneumothorax. Pneuma being air. A pneumatic tool.
It's glaring on it.
A pneumatic tool, a pneumatic tire. A hemothorax would be blood or fluid. So what you would do is, what happens is, the lung collapses. It can form into what's called a tension pneumothorax, where it actually deviates the trachea. And if it deviates the trachea, it can cut your airway off, and you can die. So what we're going to do is we're going to use chest seals. So we're going to hope not to get to that position. So these are your chest seals, and generally you'll get a 2-pack, and all they do is you just peel them and stick them. Now, if you've got an entrance wound, you're going to roll him and check for an exit wound, because if it went in, chances are it came out. So you're going to put a chest seal over the entrance wound, chest seal over the exit wound. Now, that is taken care of our hemorrhage, okay? So what we're looking at now is airway. Now this should sound familiar. We're going to maintain an airway.
14.
Now how are we going to do this?
Dad, 14.
Okay. All right, I'll tell you what, we're just about up on the time again, so we're going to pause it, and then we'll come back and we'll start airway.